Hi all, I'm Dr. Neema Bhatt, Senior Consultant Hematologist, Bone Marrow Transplant Physician and Pediatric Oncologist. I'm a Senior Consultant here at Apollo Hospitals, Bangalore. Today I'll talk about a topic which most of you are probably familiar with, but we'll talk about it in a little bit more depth. So there's a disease called sickle cell disease or sickle cell anemia, which is a type of blood disorder where the patients who are affected with the disease are born with abnormal production of red blood cells. These patients run into various issues during the span of their life, and these problems or health symptoms start when they are about 9 months to 1 year of age. Patients can have swollen joints, especially finger or toes. They can have fevers, they can have recurrent infections, they have low hemoglobin, which requires them to get transfusions, blood transfusions repeatedly. They can have repeated acute chest or chest infections. And one of the most deadly and dreaded complication of the sickle cell disease is stroke. So stroke is usually a disease of the elderly. You don't see stroke in people who are below the age of 50, 55. But in patients who are affected with sickle cell anemia, stroke can be a deadly consequence or complication even by the age of 6 or 7 years. These patients with sickle cell anemia have to be diagnosed at the earliest with the appropriate tests. So whenever there is a doubt for a patient or family member having sickle cell disease or sickle cell anemia, all the first degree family members need to be screened with the help of blood tests, simple blood tests like CBC and hemoglobin electrophoresis, maybe sometimes requiring genetic tests to make sure that the diagnosis of sickle cell disease is established. Once sickle cell anemia or sickle cell disease is established, these patients have to be on a regular follow-up with either a pediatric hematologist or an adult hematologist. What this helps is making sure that they have a good quality of life, and most of the complications can be prevented with the help of just medications or vaccines. There are of course a set of patients with sickle cell anemia who would benefit and who absolutely require a procedure called bone marrow transplantation. This is a procedure, it's a highly skilled and high-end procedure where we replace the blood-making factory, which is called the bone marrow, with that of a healthy donor. And this requires the patient to be in strict aseptic precautions under strict monitoring in the hospital for approximately 2.5 to 3 weeks. What happens in a bone marrow transplantation is we give medications to completely empty the bone marrow or blood making factory of a patient who is affected with the disease and replace it with that of a normal donor. So very similar like a kidney transplant or a liver transplant. However, this does not require the patient to go to the operation theatre. It is done as a procedure by giving medications and stem cells in serially well planned course, and it's conducted in a unit called the bone marrow transplantation unit. Why is it important for sickle cell anemia patients to undergo bone marrow transplant? As I said, these patients are at high risk for repeated infections, they're at high risk for chest infections, and they're at high risk for stroke. When we pick up patients with sickle cell disease, they can be either in India or in the subcontinent of Africa. We see that these patients end up with a lot of complications, either because they don't have access to blood products, there is a high risk of infections, or because they're just not taken care of by the right doctors. So bone marrow transplant is a procedure that, if well planned and executed, comes with an outcome of approximately 85 to 90%, especially if the patient has a fully matched HLA donor. So in the scenario of a fully matched HLA donor, sickle cell anemia or sickle cell disease is something that deserves to undergo bone marrow transplantation in a proper center with the right physician or the right specialist. In case you have any other questions about bone marrow transplant specifically for sickle cell disease patients, please reach out to us at Apollo Hospitals, Bangalore. Thank you.